One of the big topics that floats around out there and questions we get all the time is, should I consolidate my student loans?
Again, maybe, and it depends upon what your interest rates are. There are various student loan companies out there. Private student loan companies are very highly rated. We oftentimes are looking to consolidations for our clients. One, it can lower the interest rates potentially. We can lock in fixed rates. A lot of them have the same type of similar disability benefits. Should you go on a claim, they may waive. If you were to die, they may waive, like the federal government program. So you want to make sure you work with a very highly recognized carrier that has those provisions. There are variable rate options as well that can get super low, but the only downside with those is those will gradually go up if interest rates go up, which they likely will at some point. The downside to consolidating is that you do lose the benefits of the Fed, and the Fed is typically a little bit more lenient when it comes to forbearance, if you're under financial difficulties, things of that nature. And the other big thing is if you do consolidate, important note, you will not be able to use any type of income-based repayment plan. You won't be able any forgiveness for public work, nor would you receive any 25-year income-based repayment forgiveness as well.
Okay.
So it depends upon the goals, objectives, and the individual circumstances.
Got it. And it sounds like the timing of consolidation is going to be very important and different for everybody as well.
Timing-wise, so a lot of students will graduate and want to consolidate immediately. We typically recommend waiting for a little bit where their grace period is up. That way we can work on building up savings, hopefully get some more income and cash flow saved up. Their credit score theoretically would be better because if you do a private consolidation, they're going to be based upon your income, your debt to income ratio, your credit score, and all those other things like a normal loan would be. And so we want to try to build up as much savings as we can. We want to get your credit score up as much as we can. In some circumstances, if students or residents, new practitioners have relatively low credit scores, we'll actually want them to wait for even longer than 6 months to work on consolidating. One thing to keep in mind, as soon as you consolidate, most likely those bills will become due immediately. So you want to wait until you're prepared to start making those payments.
Yeah, really, really strong point. So clearly, I like to ask big questions that don't have any one particular answer. If you are going to consolidate, fixed versus variable rates, strengths, weaknesses?
So depending upon the time frame of the consolidation. So if we're looking at a 15-year or 20-year consolidation time horizon, I personally like the fixed rates. And the reason being, rates are relatively low right now. They've been creeping up recently, but they're still pretty low, and you can get those fixed rates and locked in for the entire 15 to 20-year period. The variable rate option, you would actually be able to get a little bit lower rate now, but it's not locked in. It will gradually go up if rates increase, which they likely will at some point in the future. So the variable rates could save you money up front, but could actually cost you more money in the back end. So if you're looking at a 5-year repayment plan, variable rate may be a great option. A 10-year, maybe you could do variable or fixed, but if you start looking into a 15 or 20, I really think a fixed may be the best option for a lot of people. But remember to consult your own personal advisor.
We're caveating that. All right, so we talked a little bit about during residency, depending on who you are, your situation, you may want to or need to defer. If I need to, or that's for me, how do I do that?
So if the loans are federal, you would call that program, and they're usually very qualified people, and they're very nice, and it's usually a pretty quick transaction. They do it often. You would call them and just explain to them what's going on. Say you have you're in residency, or if you're having financial difficulties, and they can forbear or possibly defer your loans while you're in residency. Private loans, if you have private loans, you would just contact that carrier in the same type of situation, and they would help you throughout that process.
Okay, so pretty straightforward. Get with the people who the loan is through.
Now, keep in mind, the one downside to doing that is that your interest would continue to accrue during that time frame, likely. So it may make some sense to pay off those at least some payments for the interest to keep it down a little bit. But again, oftentimes I recommend if people are really struggling just to survive, it may make sense just to sacrifice the interest and just get through life as best as you can, be the best resident as you can, and deal with it a year down the road once you have more money.